Good morning. Thank you for joining me as we designate today, October 19th, as Lock 'em Up Day in PA. As legislators, we hear all too often about medication diversion, which is when family members, healthcare workers, cleaning personnel, and others steal prescription drugs to use for illicit purposes. We know of the horrible consequences of drug abuse, and with our Commonwealth losing hundreds of people per month, and it's an average of 10 people from our state a day, we lose them to the opioid crisis. I believe we should do all we can to eradicate this scourge on our society and within our communities. According to a research brief by the Pennsylvania Health Cost Containment Council, between 2000 and 2014, there was a 225% increase in the number of hospitalizations for overdose of pain medication and a 162% increase in the number of hospitalizations for overdoses of heroin. In 2015, more than 3,500 Pennsylvanians died from overdoses of opioid drugs. Many people who eventually abuse heroin and other illegal drugs begin with prescription drugs, and often they obtain these drugs from family members. According to the United States Substance Abuse and Mental Health Services Administration's National Survey on Drug Use and Health, 53% of persons aged 12 or older, I'm going to repeat that, aged 12 and older use pain relievers non-medically in the past year, and they obtain them from a friend or a relative. Today I call on all Pennsylvanians, especially our senior citizens, to lock up their prescription drugs to prevent medication diversion. Many lives depend on it. Next, I'd like to introduce our friend, Secretary of Aging, Teresa Osborne. Secretary Osborne, thank you for being with us today.
Well, good morning. It is certainly a privilege to be here today with all of you. These distinguished guests behind me, and in particular Representative Boback, for inviting me to be here with you this morning, this 19th day of October 2016, which, due to all of their efforts and with the support of many House colleagues, is designated in Pennsylvania as Lock-Up Day in PA. A day whereby the Pennsylvania House of Representatives and all concerned stakeholders invites, encourages all Pennsylvanians, but in particular our older Pennsylvanians, to properly store and or dispose of opioids and other prescription drugs. In a recent talk, Governor Wolf emphasized that the opioid epidemic affects every walk of life. Rich, poor, black, white, young, old. This opioid crisis shows no prejudice in its reach and in its devastation. A crisis that has resulted in 10 Pennsylvanians dying every day from a drug overdose. A crisis that has claimed the lives of over 3,500 overdose deaths in 2015. A crisis that requires us, that really begs us to help secure treatment for those suffering some substance abuse disorder. A crisis that puts naloxone into the hands of our first responders. A crisis that has pushed our state to put drug take-back boxes in countless counties across Pennsylvania. A crisis that has touched the lives and has impacted many, many Pennsylvania families, including my own. A crisis that allows me to stand here with you today with a personal vested interest and a professional commitment as the Pennsylvania Department of Aging works alongside of all of you, all Pennsylvanians, to ensure that our commitment to older Pennsylvanians, that they are aware of and educated about this epidemic. And while much of our public education is rightfully and appropriately devoted to addiction prevention, beginning in really the elementary years, most people might be surprised to know that substance abuse and addiction is actually an incredibly growing problem among our senior citizens. Substance abuse and education and addiction of it does exist in the elderly population, and it's not something that family members, caregivers, physicians, and other people typically think about, let alone talk about. because simply they may not feel comfortable asking about it. Older adults often take multiple prescription medications, which can lead to dangerous drug interactions, particularly if the medications were not all obtained from the same physician or the same pharmacist. And according to the Substance Abuse and Mental Health Services Administration, 3 out of 10 adults between the ages of 57 and 85 use 5 prescription medications or more, and oftentimes these drugs land in the hands of a person who they were not prescribed for: family, friends, healthcare workers, individuals who enter the life of an older Pennsylvanian. That is why our Pennsylvania Prescription Drug Take-Back program and today's Lock 'em Up Day in PA is so critically important, so that together we can focus our attention on alleviating the health and safety concerns and the diversion of abuse of prescription medications by helping our communities and our seniors properly dispose of unused prescription medications. Together, may we all do our part to take back those prescription drug pills and ensure that proper storage and disposal of opioids and other prescription drugs is our goal. It is now my honor to turn this microphone over to Representative Tim Hennessey, who is the chair of the Aging and Older Adult Services Committee in the House.
Thank you, Madam Secretary. Thank you, Representative Karen Boback, for calling this press conference and getting this initiative rolling. And thanks to all my colleagues. I'm pleased and proud to join them today as we try to call attention to one small step that we can take to try to address our seniors and help them help their children, their grandchildren, visitors to their house, whatever, to keep from falling into the trap of opioid addiction or any kind of medication addiction. Like all of us, our seniors are creatures of habit. As we age, our children move out, and perhaps we live alone or with a spouse, but whatever we do, we tend to just operate step by step the same way we did every other day. We may, and one small step is that we may put our medicines open on the counter. I know years ago I used to keep mine on the kitchen counter, just so it was easy to take them, and it would remind me every morning. But the bottom line is, it's just, that what was routine to me, my medicines could hide in plain sight, in the sense that I really didn't pay much attention to them during the course of the day. But when I realized that when my children or grandchildren might stop over, or visitors would stop over, what was routine to me was something quite new to them. They might see those medicines, they might decide that either by mistake or by intent to take those medicines, or take some of them and use them for purposes that we didn't intend, that medical people didn't intend, and it could lead to tragedy or a change of life. So it seems to me that we can take a very small step today, just by reminding our seniors to take care of your medicines, hide them, put them out of sight, so that they don't become a temptation for anybody else who doesn't have any claim to them and no reason to take them. It's a small step, but it's a step that would help as the governor has addressed this opioid crisis that faces our Pennsylvania community. We can do it. Every senior across Pennsylvania can take 2 minutes and secure their medicines, keep them out of harm's way, keep their grandchildren out of harm's way, and help us confront and defeat this crisis. So thank you very much. It's now a pleasure for me to introduce my colleague, Matt Baker, from the northern tier of Pennsylvania. He's been the chairman of the House Health Committee, and we work together on a lot of issues. It's my pleasure to introduce him to you. Matt Baker.
Good morning, everyone, and thank you very much, Tim, and Madam Secretary. Thank you very much for coming out this morning and supporting this worthy cause. And many thanks to Karen Boback, who had to get over to the Senate. She has a bill moving, so she asked me to sort of keep things rolling here. As you know, Pennsylvania, like the rest of the nation, is in the midst of the worst overdose death epidemic ever. Since 2000, 1.5 million deaths are a result in the United States. Approximately every 20 minutes, a person dies. In 2015 in Pennsylvania, per the coroner's report, Pennsylvania coroner's report, 3,505 overdose deaths. 30% increase over 2014. 81% of the deaths involved opiates, and the vast majority had more than one drug. In Pennsylvania, 10 people die every day. In the US, about 129 people die every single day. So it's very, very important that we come together today in the House, members, bipartisan, nonpartisan. This is an issue of great concern to the governor. I was with him in a press conference yesterday afternoon, and we're all on the same page to try to address this terrible scourge and the death toll that's transpiring every single day in our state and our nation. Let me talk a little bit about the prescription drug take-back program. A flood of prescription opiate pain medication in Pennsylvania communities is largely responsible for the opiate overdose death epidemic. And there's been great efforts by the Department of Drug and Alcohol Programs, DDAP. They've partnered with the Pennsylvania Commission on Crime and Delinquency and the Pennsylvania District Attorneys Association to provide grants that facilitate the installation of hundreds of secure and permanent prescription drug take-back boxes installed throughout Pennsylvania. Many municipal police departments. To date, more than 450 take-back boxes are located across the Commonwealth. And very soon in every county, Pennsylvania will have a drug take-back box in it. The Attorney General's Office and the National Guard have been invaluable partners with DDAP, collecting the drugs dropped off to take the take-back boxes and destroying the drugs. These prescription drugs were at great risk of being diverted and abused, particularly by our youth, so the proper destruction of these drugs is a life-saving venture. With this collaboration, the prescription drug take-back program has been a big success. Let me give you some updated information. The total amount of drugs taken back and destroyed in 2015 was 56,252 pounds. In 2015, the Attorney General's Office and the National Guard collected and destroyed 45,840 pounds of the 56,252 total pounds collected statewide. At last count, 24,081 pounds of prescription drugs have been collected and destroyed this year. And with the Attorney General's Office and the National Guard responsible for the destruction themselves of 14,660 pounds. So since the program started, about 150,000 pounds has been collected and destroyed. Prescription drug abuse and overdose are a growing crisis in Pennsylvania and across the nation. According to the 2011 survey in Pennsylvania, 14% of youth surveyed admitted taking prescription drugs that were not prescribed to them, and 18% felt prescription drugs were not harmful. 4 of 5 new heroin users first used prescription drug pain medication. And all of this is even worse when combined with alcohol and other drugs. And when you look at the Pennsylvania coroner's report, almost every overdose death had a combination comorbidity levels, toxicity results of several medications in the blood system. So it's a serious, serious problem. I want to commend the House, the Senate, the governor for this great effort in addressing these issues, and I want to commend Karen for this great effort to make more awareness with our people to lock up those medicine cabinets and for people to take their medications to the drug take-back boxes. It's very, very important. There's just entirely too many casualties, too many deaths too many people going to the hospital for treatment. And of course, we have a lot of people in recovery centers that can't keep up with the demand for treatment. And I want to commend all the members here for their great efforts. And I'd like to turn it over next to my good friend and fellow Health Committee member, Aaron Kaufer, Representative Kaufer.
Thank you, Chairman Baker, Representative Boback, Secretary Osborne, everybody that's spoken so far. This is a serious issue. And when we talk about locking up prescription drugs, it is one small piece of a comprehensive plan that we have to have going forward to address this issue that's all throughout our community. For anybody watching or anybody listening today, it's not about you. It's about the people that have access to where your prescription drugs are. Make sure that take that little extra step to make sure that they're not getting into the hands of people who should not be having them. Addicts who live and prey upon abilities to get access to drugs that they are abusing, in turn making it to the street, and eventually to overdoses and deaths. We need to be looking at this in a much more broad issue. This is one piece that we need to bring attention to. The little old lady or the little old man that's sitting there that has the prescriptions that's been sitting in their cabinet, it's just waiting for somebody, maybe not necessarily a grandchild, but maybe a grandchild's friend who happened to be in the house and happens to be going through it. We can all fall victim to this regardless. When we talk about prescription drug take-back in the tons, we're talking about tons of prescription drugs that have been taken back. Think about how heavy a pill weighs, how heavy that little bit weighs. To be talking about tons of prescription drugs taken back. We must be doing more. We must bring attention to this issue. And I applaud Representative Boback for bringing this forward. Make sure we are locking up our prescription drugs. It's now my honor to bring forward my co-chair of the Hope Caucus and a really good friend of mine and a stalwart advocate on behalf of this issue, Representative Ed Gainey.
Good morning. I think Representative Boback needs a big applause because you couldn't explain it any better but to say lock them up. This is about love and this is about family. And this is about how we keep our families safe. And the reality is we understand the crisis and epidemic that we're in, not only in Pennsylvania, but throughout the United States. And the first line of rehabilitation, the first line of recovery, is to make sure that we as a family do what we have to do to ensure that our loved ones, particularly the young ones, but all of them, do not get a hold of prescription drugs. If we lock them up and keep them safe and make sure they're out of the way of our loved ones and children, then right there we just saved a life. We just made sure that our family won't walk down that road of addiction and don't have to go through the type of things that we know other Pennsylvanians and Americans are going through and trying to get our life together. That's the first line of defense. Lock them up. Let's make sure as we go forward as a Commonwealth, that as the PA Hope Caucus has talked about, moving from addiction to recovery, let's make the first line of defense that every prescription drug you have in your house, make it look like that's the enemy of my children, the enemy of my family, and it's up to me as the person that has to be responsible and take them, that I lock them up. And if we together begin to lock up our prescription drugs, we can save the next generation. Thank you.
That concludes today's press conference, media event. Just as a reminder, the whole purpose of this resolution, Lock 'em Up Day in PA, is to bring awareness that in our medicine cabinets, there may be lethal combinations, of drugs combining with other street medication. Please remember that and lock 'em up. Lock up those drugs. Thank you for attending with us today. We appreciate it.